I've heard of these electrolyte drinks that all these influencers are asking you to take once a day in the morning. For example, this one here called Element. They make tons of money. For example, here you can see Element makes over $200 million a year. And I was interested in taking this for my own health. So I thought I would dive into it and figure out whether it's actually legit or not really good for me. And I'm going to show you what I found. Here's what Element says. Most people recommend less than 2.3 grams of salt per day. This is what medical organizations recommend, but the science-backed recommendation is 4 to 6 grams per day. That sounded interesting, but when I looked into it, I found out it was not accurate. So I'm going to talk about why I won't take any of these electrolytes, why the medical science used in advertising I think is misleading at best, and why we need more public awareness to prevent harm, because on balance, I think these products do more harm than good. Why I would never recommend these for the general population. I'm Dr. Huck. I'm a Harvard-trained doctor here to give you evidence-based health insights. Feel free to check out my free newsletter, medicalwisdom.org, for deeper dives and personal takes. So this is what we see on the website for Element. They have this graph showing how much sodium people excrete per day, and they show how much of an increased risk somebody has for a cardiovascular event. This is from a study in JAMA 2011. And they draw this little line here, which makes it look like the optimal dose that somebody should have to have the lowest risk is between 4 and 6 grams of sodium per day. So I went and I looked up the study, and first of all, it's a non-representative sample. So it's not the general population. Number two, the study was conducted on high-risk patients, people with cardiovascular disease, diabetes, type 2, with end organ damage. So you can't generalize from that sample to the whole population. These people were on all kinds of medicines that are doing all kinds of things to their electrolytes. So we just can't extrapolate from that study to the general population, regular people browsing electrolyte supplements. I think that's scientifically both inappropriate and misleading. The second issue is that this study used pretty bad study methods, which are known to produce these artifacts, these J-curve artifacts, which show under 4 grams per day, there was higher risk at lower doses, higher risk of cardiovascular events in the graph. So in this 2011 study, they estimated sodium intake from a single fasting morning spot urine sample. This is called the Kawasaki formula. And that's not the gold standard method. The gold standard method is multiple 24-hour urine collections. And what I'll show you later is when you actually do better methods, these findings don't hold up. And the reason is the single fasting metric they use includes all these other things that are also associated with cardiovascular risk: age, sex, body weight, urinary creatinine. So it's not very accurate. And it creates what's called confounding. It artificially inflates the risk at the low end of the sodium excretion curve. That's why you have this J-shaped curve. So that's just fancy talk for saying it's creating these artifacts. When a follow-up study was done that used a proper measurement method, a gold standard method, which is the 24-hour urine collections, this J-curve actually disappears. So since 2022, we've known that, and I think any of these electrolyte companies should have basically stopped selling their products after this study came out. Because in this study from 2022, which is much more strong methodologically, there's a linear dose response relationship between sodium intake and risk of cardiovascular events. So it's not J-curved, it's actually linear. Specifically, for every 1 gram or 1,000 milligrams per day of increase in sodium excretion, people had an 18% higher risk of cardiovascular events. So imagine going from a normal American recommended diet of 2,000 to 6,000. You're going up by 4,000 milligrams or 4 grams a day. So 70-something% higher risk of cardiovascular events if you listen to Element. And more importantly, this study found no evidence of increased risk when the sodium was under 4 grams. So there's no J-curve. Here's the graph. As you can see, there's no J-curve. It's a linear curve, basically. As you go from low to high amount of sodium excreted, you have more cardiovascular disease risk. And the lowest risk is 1,000 milligrams per day, maybe 1,500, 2,000. It's just not true that it's J-shaped. The lowest amount is not 4 to 6,000. That's much higher risk. So, as a doctor, you got to worry about these misleading claims. And most people don't look into this stuff, and they just hear influencers talking about stuff, making commissions. And of course, companies want to sell products, so they're going to downplay things. The other thing about the study that is on their website is that the increased cardiovascular risk at lower sodium intake can be explained by what's called reverse causation. This is a epidemiological term, but it just basically means that they used a very low quality study called an observational study. It's like a snapshot. It's the lowest quality for causal inference. And the later ones are randomized controlled trials. So lower sodium does not cause more cardiovascular events. It's that people who are already sick. Remember, this study had people with cardiovascular disease, diabetes, and organ damage. Those types of people are going to eat less food and less sodium, and therefore are going to excrete less sodium. And therefore, you're going to see this artifact of reverse causation. And when these people have higher cardiovascular events, it creates this false appearance that low sodium intake is harmful. So we even have an explanation of why that curve looks the way it does in the observational study, the bad study. It's not a mystery. It's just an artifact of the study population. It's not a causal finding. It's a terribly low quality study. It's not randomized controlled. It has all these selection criteria problems. And as I mentioned, these randomized trials directly contradict LMNT's interpretation. So there's another study called the Salt Substitute and Stroke Study. It looked at a bunch of people across 600 different villages in China and found that regular salt or potassium enriched salt substitutes, which reduce sodium intake, what they do is they reduce stroke, cardiovascular events, and all-cause mortality as people eat less sodium. So in these 5 years or so, 4.7 years of follow-up, 14% reduction in stroke, 13% reduction in cardiovascular events, and 12% reduction in all-cause mortality in the group that had reduced sodium. That's pretty hard to explain away. It's a high-quality, high-powered study, randomized controlled trial. This is a big problem if you're selling this product. And from a public health perspective, it's misleading to tell people that it's not true that if you reduce sodium, you're going to save lives, because you are going to save lives. It just doesn't make a lot of money. It's boring. I know this is kind of complicated. So if you want to follow some of this research and some of the studies and some of the summaries here, in the description, there's a link where I give you a free PDF guide, key takeaways, things you can ask your doctor if you want to talk about salt intake, and any other interventions you want to discuss. It's only educational. It's not medical advice. The other thing to remember is that pretty much all the major cardiovascular organizations disagree with LMNT and similar companies. But you can look at the 2025 American Heart Association hypertension guidelines. They recommend 2,300 milligrams per day or less. Ideally, less than 1,500 if you have high blood pressure. And tens of millions of Americans have high blood pressure. Most people don't know they have high blood pressure. Similar statement in 2023, coronary disease guidelines, 2,300 milligrams. The World Health Organization recommends less than 2 grams per day. And these are summaries based on the totality of the evidence, not a single observational study with multiple confounders and non-representative samples and non-gold standard measurements of sodium that LMNT is advertising on their website. Now look at the actual nutritional label. In one pack of this LMNT, you're getting 1,000 milligrams of sodium, which is a ton. Some people take a couple of these per day. Potassium of 200 and magnesium of 60 milligrams. We're going to go into what some of this might mean. And also notice that you're getting 50 milligrams of caffeine too, which maybe people don't realize they take in addition to their coffee. So this is a blog post written by one of the co-founders of LMNT, where this guy, Rob Wolf, tries to justify the company's advertising. And he's saying that the World Health Organization's guidance on sodium is misguided. So I'm going to go through some of his claims and show how they're not accurate. So in some sense, this is a $200 million blog post. What he's trying to do is save the company. That's how much they're making per year. Maybe more than that. It's maybe $1 billion blog post. So they have an incentive to try to downplay that evidence. So let's see what he says. So the first claim is the InterSalt study found zero correlation between salt consumption and high blood pressure. This is one of the studies we talked about. It's just factually incorrect. What they actually found is a significant, positive, independent, linear relationship between 24-hour urinary sodium excretion and blood pressure. In fact, for every interval of sodium increase, there was a higher systolic blood pressure of 3 to 6 milligrams per mercury. And from age 25 to 55, it was 10 to 11 milligrams per mercury greater. So it's just not really accurate in what he's saying. And then even if you look at this other study, the PURE study, which the LMNT website relies on, actually confirms this relationship, which is weird. So they're saying something in their blog that's contradicted by a study they themselves cite. There's a steeper sodium blood pressure slope at higher intakes. Here's the study on the urinary sodium excretion and blood pressure. It's quite linear, isn't it? So it's hard to argue with this kind of data. The researchers compared even Chinese data with the rest of the world. Pretty linear. We don't see the J curve. Second claim is that sodium restriction has very little effect on blood pressure in normotensives. This is also false. Modest salt reduction lowered blood pressure by 5.3 milligrams of mercury in people with high blood pressure and 2.4 milligrams of mercury in people without high blood pressure. And this is from a Cochrane meta-analysis of 35 trials, greater than 4 weeks. It's just not true. You look at really high quality studies, that you won't find that. You're going to see consistent blood pressure reductions across both hypertensive and normotensive populations. And pretty much all the major meta-analysis of randomized salt reduction trials show this. I just don't know where this claim is coming from. It's just not consistent with what we know. Here's a forest plot where you can see a summary of all these other studies, and you can see consistently, almost all of them show the same effect. You have a reduction. You can see all of these blue dots are to the left of this line, which means that there's a reduction in the blood pressure. The third claim is that this Cochrane collaboration review found that low salt diets correlated with a measly 0.4 milligram per mercury reduction in mean arterial pressure. This is like kind of cherry-picked or misleading. It's from this Cochrane review, which was specifically criticized for including very short-term trials. So 32% of the trials were less than 1 week long. And these trials triggered acute compensatory hormonal responses irrelevant to the sustained dietary change. So they were studying compensatory hormonal responses. They weren't studying sustained dietary change patterns. And they were less than 1 week long. So it's not really a fair study to be using in the defense of a high salt diet. In addition, if you look at other trials, like the DASH sodium trial in the New England Journal of Medicine, this is now a rigorously controlled feeding study. This demonstrates that the true magnitude of sodium reduction's effect on blood pressure is very significant. So here's the data from that. As you can see, as you go from low to intermediate to high amounts of sodium, the blood pressure goes up. It's linear. There's no J-curve. So again, just another example. So this figure shows that reducing sodium from high to low is lowering systolic blood pressure by 6.7 millimeters of mercury on the control diet and 3.0 on the DASH diet. This is not a measly 0.4% millimeters of mercury. It's significant. Now, if you look at the combined effect of low sodium plus a DASH diet, you're going to see reductions of up to 20 millimeters of mercury in people with a baseline blood pressure above 150. So this can be life and death for some people. This can be stroke inducing or non-stroke inducing if you listen to this advice or not. This is important stuff. Claim number 5 from this blog: your body will break down bone to maintain sodium levels at dietary intakes as low as 3 grams per day. So it makes you want to think that I have to have more than 3 grams per day. Otherwise, my body's going to break down bone to maintain my sodium levels. Oh, I'm scared now. But this is also false. This is like anyone with the basic knowledge of bone physiology and electrolyte physiology would know that this is hyponatremia. Hyponatremia is a clinical condition where you have low sodium, typically less than 135. It's not the same thing as dietary restriction of sodium. Totally different things. This thing that he's citing is on bone resorption. It's coming from studies of pathological hyponatremia, low sodium, such as things like there's something called SIADH, which is a hormonal thing, where rats were pharmacologically induced to have plasma sodium less than 110, very low, and then you see what happens with bone. But again, this has nothing to do with dietary sodium intake levels. This is like elementary mistakes. Our normal kidneys maintain serum sodium within a very tight physiological range, 135 to 145, across a wide spectrum of sodium dietary intake. So that's an amateur mistake. So it's just not true. And if you look at studies, there's no high quality evidence that dietary sodium intake of 2 to 3 grams per day causes hyponatremia or clinically meaningful bone loss in people with normal kidney function. It's not true. Claim number 6, WHO's central claims aren't supported by peer-reviewed sources. Gosh, that you could just know is false by just looking at their report. Their sodium recommendations are supported by extensive peer-reviewed evidence across multiple high-quality studies, decades, randomized trials. LMNT is citing an observational study, which is like the worst standard of a study on their homepage, on their landing page, to increase clicks from a graph. And now they're discounting what the World Health Organization has cited. And, we know in randomized trials that simply substituting regular salt with a reduced sodium salt substitute has led to this 14% reduction in strokes, 13% reduction in cardiovascular events, 12% reduction in mortality, dying. So it's just not true. It's just false. It's just not accurate. Here's a graph from this New England Journal of Medicine study showing clear differentiation between regular salt and the salt substitute in mortality, cardiovascular events, and stroke over time. Clear findings. You can see the yellow line differentiates from the blue line over time. Claim number 7, salt isn't the problem. It's the modern diet. That, it's really people are blaming salt, but it's just this other modern diet. There's a confounding argument going on here. Again, this is a false dichotomy because blood pressure effects of sodium have been demonstrated in very tightly controlled feeding studies where participants consumed researcher-prepared meals, highly controlled environments with precisely controlled sodium content. So there's no confounding from ultra-processed foods here. You just have to look at the actual studies on this topic and you know this is false. And if you look at some other studies where they actually look at the person's hypertension status, whether they have hypertension, whether it's controlled or not, the blood pressure lowering effect of restricting sodium is consistent. It doesn't change when somebody has uncontrolled hypertension, no diagnosis of hypertension, which presumably is happening from their modern diet, processed foods, etc. So sodium itself, independent of other dietary factors, directly is affecting blood pressure. Here's an image from this study where you can see pretty much the same effect on blood pressure, regardless of whether someone has blood pressure problems, it's controlled or it's uncontrolled. So what that means, you can't really use this. It's the modern diet confounding argument. And in the studies on this topic, they're highly controlled. So what do I take from this? 4 to 6 grams per day is not consistent with the best research. It's misleading to say that. It's not accurate. There's no safe sweet spot at higher intakes. I would not consider this to be an ideal thing to do, just daily, casually in the morning. If you see what some of these influencers say, I just have a couple of these every morning and start my day off really well. Most people need less salt in their diet, not more. And if you look at the graph I showed you earlier, even 1,000 milligrams per day had the lowest cardiovascular event risk. Remember this graph here? Look, it's relatively linear. And the average American is actually getting too much. The average American gets about 3.4 grams per day, 3,400 milligrams per day. Ideally, they should be getting under 2,000 or so for a normal person. The general recommendation is about that, maybe 1 teaspoon of salt per day. If somebody has high blood pressure, which is like, look, 120 million Americans have high blood pressure. So 1/3 of Americans are at risk, and they should not be following this advice, I think. And the standard advice is if somebody has a high blood pressure, they should go lower to 1.5 grams per day, 1,500 milligrams per day. We know from the studies I've showed you that less salt equals less stroke, less heart attacks, and less death. That's the most important thing to remember. For a generally healthy person, following your thirst, eating a healthy diet, having normal fluid intake, and healthy kidneys is your best guide. I understand businesses need to sell their products. They're not really incentivized to be accurate. They want to make money. I get it. But you want to know the truth, right? And if you love someone, you want to tell them the truth. If you care about your patients, if you care about your family, you want them to know the truth. That's why I decided not to take this stuff, and I wouldn't recommend it. And I would use caution, especially if somebody was thinking of doing this daily, regularly for the rest of their life. You want to try it once, fine. But if you have high blood pressure, hypertension, kidney disease, heart failure, if you have a high coronary calcium score, you have a high LPA, you have all these metabolic syndrome things going on, you have swelling and edema in your legs when you wake up in the morning, if you're pregnant, if you have any liver disease, fatty liver, cirrhosis, pregnancy, these things that I just mentioned, this is like 80% of Americans have one of those things. It's almost like everyone's at risk if they listen to this stuff. And the caffeine, the extra caffeine is not always good either. You're probably drinking some coffee and tea already. Do you really want to put yourself at risk for other stuff, insomnia, arrhythmias? And many people are on water pills, diuretics, and those can mess with your potassium. So why would you take these extra electrolytes? So that's why I would be very cautious in these populations, which is like the vast majority of people, isn't one of these things. There are some exceptions when people do need more salt. Now, this is going to be narrow, context specific, and very time limited scenarios. This is not daily routine use like these companies want to sell. So for example, if someone is very heavy sweating, like they're working out in extreme heat for more than 2 hours, the average American, you can't get them to do 30 minutes of exercise a day. So if someone's like an extreme endurance athlete doing ultra marathons, yes, you're going to lose a lot of salt in sweat. So you might need this. If somebody has a medical condition with low blood pressure symptoms, like if they have POTS, their doctor may prescribe salt tablets. If they're doing a low carb or keto diet, and again, this is only for the first couple of weeks because the body will adapt. So it's not routine long-term use. They might want to consider this with their doctor. But even here, there's no randomized trials establishing that the optimal sodium intake specifically for individuals on a low carb diet. There's no good research here either. So it's not an evidence-based thing, even for people doing keto and low carb. So again, there's a lot of complicated science here. If you want a PDF guide for this video, check out the link in the description. Things to talk about with your doctor. A simple question of whether to take LMNT or an electrolyte solution is not so simple. I hope you've learned from this. Pass it on to someone who may need to hear this. Check out this other video. Feel free to join my free newsletter, medicalwisdom.org. Take care.